But at any rate, what this website does is it allows you to look at county by county or state by state, and eventually block by census tract by census tract, what is the availability of high-speed internet versus medium and low speed, and what is use of the internet in relation to various health conditions. So this is just a couple of screenshots where I looked at what is people's access to the internet, and so blue is strong, yellow is not, and what is the availability, access is the download speed, so to what extent do people have access to quick download speeds, and what is adoption. And you can see that the areas that are yellow in both are where there's limited high-speed internet and, not coincidentally, lower levels of internet use. And then you can layer on various health conditions. And so this is looking at obesity, areas where obesity is prevalent, and this is where internet adoption is less than 60% of the population. So all these dark-colored areas have low internet and high obesity. Over here, when you change internet coverage to high, you see that these obese areas no longer are purple, which means the people who are obese are living in areas where a lot of people are not using the internet. So obviously these are connected with, the socioeconomic factors, but we want you to think about them. We also have on our program's website, which is Health Data Matters, the ability to look at broadband access and use in relation to health in our own community. So each of these represents a census tract in the Cleveland area, and you can look at to what extent the areas where there's high-speed internet available tends to have be areas that were not redlined as much 40 years ago, and similarly, areas that were redlined 40 years ago where there was discriminatory lending have a much worse life expectancy. And we also see a relationship between broadband and life expectancy. Obviously, these things are not causal, but I put this out here to make the case that broadband is an equity issue that has many effects on health.